dementia awareness. Can we welcome Dr. Louise, Dr. Sadaf, and Dr. Ruqayya to this seminar? It's honor to have them every time in Deeplish. Can we also welcome our colleague Zoe? She will be, of course, coming to Deeplish in our next seminars, and of course, can I welcome Sadaf and Ruqayya's parents. It's my pleasure to see you, to know you, and of course Sadaf's husband. Some of them I've seen you, and of course thank you for my volunteers team. Thank you for Kashif Saab. Today is the National Pharmacist Day, so Kashif has honored to give us some cholesterol checks and BP checks. These will continue after the session as well. After the session, we will have some interactions, question answer. So with that, I pass it to Dr. Louise. I always said, no, Professor Louise.
No, that's an unfair promotion. Hi everyone, and thank you so much for coming to this seminar, which we'll be talking tonight about dementia. So this is a difficult topic and can often be quite upsetting to talk about, but it's really important, and it's something that people, when I've come to Deeplish before, have said they wanted to understand more about. So with that in mind, we're going to do a short presentation, and then we're going to open up for questions and discussion. But bear in mind, lots of things that we can do to help prevent dementia are around, I guess, how we live our lives, what we eat, what exercise we do, and things like diabetes and high blood pressure. So this is a really great opportunity to have your blood pressure checked, and blood sugar, did you say checked as well, and your blood sugar, to see if there's any sort of increased risk of diabetes, then you can sort of address that early. So thank you very much to Deeplish for welcoming us again to come and talk to you about health related issues. I'd also like to extend the welcome to Dr. Awan, Mr. Raza in the corner, the pharmacist, who's diligently working hard. Lovely to see you. Thanks for coming. And Dr. Shakur as well. Without further ado, I'm going to hand on to Dr. Sadaf Iqbal and Dr. Ruqayya Tatachi, who is going to talk to you today about dementia. So these colleagues of mine have worked really hard on this presentation. I'm just going to sit back and spectate. I'm here if you need me, but these guys have really done all the hard work and are the experts in the room, and I feel very lucky to work with them and that they've agreed to deliver this today. So thank you so much. Without further ado, I'll hand over to you.
I think we will move.
Yeah.
Yeah, go for it. Thank you. Thank you, Sohail and Louise, for that lovely introduction, first of all. So yeah, you've introduced what we're going to be talking about today, and we do think it's an important topic for our community. I'm Ruqayya, by the way, and that's Sadaf, in case you get confused about who's here. So yeah, dementia, we're going to be talking about what we as a community should know about it, what kind of symptoms and signs to look out for, and most importantly, why it is important for us to recognise and do this early. So, does anyone have any ideas that come to their mind when you do think about dementia? And don't worry, there's no wrong answers. When somebody says the word dementia, what's the first thing that you think about? Losing memory, yeah, that's very common.
Lose confidence.
Really good, yeah. And we'll touch on exactly what we mean about losing memory, and I think the confidence one is an excellent one to highlight especially. Thank you. Thank you. So when we think about dementia, the way we used to describe it is a group of symptoms that come up when there's a condition that's affecting somebody's brain function over time. And one thing to note is that it's not a normal part of aging. So this is, you can be more forgetful as you're growing older, but this is something that's starting to affect your daily life. And that's when we term it as dementia. And the common types that we talk about mainly is Alzheimer's disease, which is the most common. But we've also got other kinds of dementia, such as vascular dementia and other sorts like Lewy body. These are just the names of the conditions, so we don't need to get too hung up on that. But the most common one is Alzheimer's disease. I'm going to hand over to Sedef, who's kindly doing because I can't speak Urdu, to explain everything in Urdu as well.
अस्सलामुअलैकुम, मेरा नाम सदफ है। ये रुकिया उन्होंने इंट्रोडक्शन कर लिया, तो मैं आज डिमेंशिया का टॉक उर्दू में ट्राई करूँगी आप लोगों के लिए करने के, जो लोग देख रहे हैं यूट्यूब पे या यहाँ बैठे हैं उनको थोड़ी शायद डिफरेंट वे में समझ आए। तो डिमेंशिया क्या है? ये सिर्फ दिमागी भूलने वाली बीमारी नहीं है, ये काफ़ी डिफरेंट सिम्टम है जो अपने पूरे दिमाग को अफेक्ट करती हैं। तो हम जब डिमेंशिया का बोलते हैं, हमारे दो डिफरेंट टाइप है जो हम कहते हैं। एक है अल्जाइमर्स, वो सबसे कॉमन है, वो ज़्यादातर लोगों में होता है, और फिर एक है वास्कुलर डिमेंशिया। लेकिन ये जो चीज़ें हैं ये उनकी कैटेगरी है, लेकिन ओवरऑल उनको हम डिमेंशिया बुलाते हैं।
So I just want to put it out there. How common do you think dementia is in the UK? Do you think it's very common? Not very common? Very common. If you could put a number to it, what would you guess? How?
After COVID, there are many people affected by it.
Yeah.
Lots of people in Rochdale.
Yeah. So you've noticed that more people are coming up. Yeah. 3 more. If you could put how many have been diagnosed with dementia, what number would you say? A rogue guess. Yeah. Okay. Yeah. So, Louise, if you want to just go on to the next slide, thank you. So there's around almost basically 1 million people in the UK that do have dementia. And it's important to bear in mind that when we talk about figures, they tend to be a bit outdated for right now. So I did have a look, and it's estimated that in 2030, this figure is going to be well over 1 million. So seeing how common it is, not just in the UK, but also within our communities, it's definitely something worth educating ourselves about. And then it's also important to note that as you get older, particularly at 65, your risk increases, and then every 5 years after that, your risk doubles. So the longer you live, the more likely you are to get dementia.
तो डिमेंशिया तकरीबन 1 मिलियन लोगों को यूके में है जो अफेक्टेड है इस बीमारी से, और ये जितना आप ज़्यादा जियोगे, हर 65 के बाद हर 5 साल के बाद आपका जो रिस्क है कि ये आपको भी हो सकता है, ये डबल हो जाता है हर 5 साल के बाद। तो मुझे लगता है इस कमरे में काफ़ी लोगों को कोई तो जानते हो जिसके पास डिमेंशिया या ये दिमागी बीमारी है।
And we mentioned some of this, so we know it's very common. We know what dementia is, we've got an idea. So what kind of things can we look out for either in ourselves or our family members and the people that we know? And one of the key things that we talk about is memory loss, but not just memory loss. It's more so memory loss that's affecting your daily life. So memory loss that's affecting your daily function and kind of stopping you from doing your daily activities. And other things that are really important to consider as well is reduced concentration, changes in judgment, thinking, and speech difficulties. So this might not always be very obvious. It might be subtle, like somebody losing their thought of train when they're speaking to you, or especially with judgment, when we're thinking about money, reduced judgment in your ability to handle money. So that could be another thing as well. And then confusion about time and place, maybe certain places that you felt were familiar to yourself, actually you no longer recognize. And another thing that we might spot, but the individual might not always spot themselves, is changes in their mood and their personality. So in terms of maybe becoming more irritable than they used to, or a bit more upset, that could be something that we see as well.
Louise, if you go on to the next slide, I'm just going to touch a bit more on these things. So, as Rook has mentioned, having a change in your memory is some of the first things people noticed, but not always the first. There are things that can happen before that. तो लोगों को अपनी याददाश्त भूल सकती है, और क्या हो सकता है कि ये ऐसे नहीं है जैसे मैंने अपनी चाबी किधर रख दी, या ये जैसे आम लोग भूल जाते हैं चीज़ें, ये ऐसे है जो अपनी दिन बाय दिन जिंदगी को मुश्किल करती है। कोई चीज़ आपको भूल जाती है और फिर लोग आपको पूछते हैं आपको याद है, और आपको समझ नहीं आ रही कि ये बात हमने की है या नहीं। You can also have a change in your judgment. So, as you mentioned as well, about things like spending, your finances, paying your bills on time, these things can also be affected in your management on how you judge certain situations. तो एक और बात है कि शायद आपकी जो सोच है वो बदल गई है। पहले आप हमेशा अपने जो बिल थे आप सारा कुछ सही तरह से कर सकते थे, लेकिन अब शायद आप भूल जाते हैं या आपको समझ नहीं आती ये बिल इसका मतलब क्या है। पूरी जिंदगी यही बिल दिया, लेकिन फिर देखते हो और अजीब लगता है कि मुझे समझ नहीं आ रही कि ये क्या है, कैसे करना है, क्या करना है। और फिर पैसों के साथ भी शायद आपको पैसों का लुक आफ्टर करना एनी मोर समझ नहीं है, या वो भी मुश्किल हो सकती है। You can also get problems with abstract thinking, and now what that means is thinking outside of the box, and thinking about concepts and things that aren't very aren't common or set out for you, like problem solving skills and your ability to solve different tasks. तो एक और बात भी है कि शायद आपको अगर कोई अजीब बात है या कोई डिफरेंट बात के बारे में आपको सोचना पड़ता है कि जो आपकी डेली लाइफ में नहीं है, उसमें भी आपको मुश्किल हो सकती है। Problems with language, so forgetting simple words, forgetting your train of thought, not being able to fully complete a sentence, or it not really making sense anymore, is another thing that people can experience with dementia. तो बोलने में भी मुश्किल हो सकती है लोगों को, शायद उनको हमेशा भूल जाता है कि लफ्ज़ अगला वाला लफ्ज़ क्या है और मैं कहना क्या लगी थी। दिन ब दिन ये हमें भी होता है, कभी ज़िंदगी जब टायर हो जाते हो काम से आके फिर नहीं दिल करता बोलने को, पर ये उससे ज़्यादा सीवियर है। जो पहला शख्स बहुत अच्छी तरह से बोल लेता था, शायद अब उसको नहीं सही तरह से समझ आ रही। We've also got misplacing things or putting them in inappropriate places. So we all do that. We all put our keys somewhere after a long day. We don't know where they've gone, or we misplace our wallet. But this is more than that. This is like if it's I'm laughing because my husband's smiling because like 2 months ago he lost his wallet. We all searched the whole house for this wallet, and then it was in his suit pocket. So that's why he just made me laugh. But anyway, back to this. That's normal. That is normal. He doesn't have dementia, but in this case, you might have somebody who's putting their kitchen utensils in their bathroom because they think that's where it's supposed to go, or the bleach is now in the pet cupboard because they've got it muddled up of where their things used to go, and they think that that's appropriate. You can also find it difficult to perform familiar tasks. Things you used to do day to day now become more difficult, as I've mentioned. And you can have changes in personality. So you can see that as people age, some changes are normal that can happen, but things like becoming increasingly more emotional or erratic or angry, these are more common signs that can happen. तो कोई लोगों की शख्सियत भी बदल सकती है, शायद उनकी याददाश्त अभी थोड़ा वो कॉम्पेंसेट कर रहे हैं, लेकिन उनकी शख्सियत बदल जाए, छोटी छोटी बात पे वो रोना लग जाते हैं, या उनको समझाओ कोई बात बहुत डिफरेंट तरह में और उनको समझ नहीं आती, उनको उसी बात पे रहना है जो उन्होंने दिमाग में सोच लिया, तो ये भी उनकी शख्सियत में अगर बदलो, फिर ये भी एक हो सकता है साइन डिमेंशिया का. You can also become more disorientated with time and place. So at the minute, I'm working with Louise actually on a major trauma ward with a lot of elderly patients, and a lot of the times people with dementia come in and you'll ask them where they are, and they wouldn't be able to tell you it was a hospital, or they might tell you the wrong hospital, or how old they are, asking for their mum and dad, things like that, just not being in the present, in the now, and knowing where they are. तो और क्या हो सकता है, उनको नहीं समझ आ रही कि दिन क्या है और मैं किधर हूँ. मैं अभी काम कर रही हूँ अस्पताल में लुइस के साथ, और वहाँ पे मैं देखती हूँ जो लोग 65 के उम्र के ऊपर है, उनको अगर डिमेंशिया हो, अगर आप उनको पूछो किधर हो आप, तो शायद कभी कहते हैं मैं अपने माँ बाप के घर हूँ या मैं होटल में हूँ. उनको ये नहीं समझ के मैं अस्पताल में हूँ और मैं इस वार्ड पे हूँ. उनको पूछो साल कौन सा है, शायद वो आपको जवाब देंगे साल 1922 है. फिर आप उनको कहते अगेन सोचो, पर अगेन सोचने में उनको फिर भी नहीं आता कि नहीं नहीं अब तो 2025 हो गया, अब तो मैं इधर हूँ. तो उनमें भी मुश्किल हो सकता है. And like I mentioned earlier, changes in mood or behaviour, becoming more erratic, more emotional, agitated, easily frustrated, angry, can all sort of play into some of the way that it can present in people. That's that.
Thank you. Thank you very much, Sada, for that. So that's a more detailed explanation of some of the things that you can spot in somebody with dementia. But we wanted to also talk about what kind of things do people think about dementia that might not necessarily be true. So a big thing, which is number one, memory loss is always first. Do we think memory loss is always first in everybody? It might be the first thing that we spot, so maybe it's the first thing that we see, but not necessarily. In most people, when you're reading the literature, it's actually changes in their judgment. So what we've mentioned about mishandling money or certain items, and then also their mood, their behavior. So are they getting more irritated? Are they becoming more angry? These are the common things that we might see first, but every individual is different as well, which is one thing that we need to remember. And as we've mentioned, so we put down dementia as a normal part of aging. Dementia is not just normal aging. So when you are becoming forgetful like that and your mood is changing and your judgment is changing, it's the aspect that it's affecting your daily life. So as we're growing older, we can become more forgetful, like we mentioned. But when we talk about dementia, it's not just your normal aging. And then, do we think it's always genetic? So if your mum and dad or your granddad had dementia, are you definitely going to get dementia? No. There's so many different factors that play into this, and even looking at the research, they can't pinpoint one thing. So we're going to talk about a few of those things afterwards, but you, just because your parents may have dementia doesn't mean that's going to be the outcome for you, and there are things that we can do early on to prevent that from happening. And do we think all memories are lost when somebody has dementia? No. What do you think tends to stay with people, and what kind of things do they tend to forget? Yeah. So, yeah, that's a really common theme. The core memories that they have, maybe of childhood or their partners, tend to stay because they've associated those memories. But it's the idea of forming new memories and the short-term memory that tends to go. So that's why when you see somebody, they might be confused, but they're calling out for their husband that they remember, because those are the kind of things that they'll still remember. And then, is dementia just being a bit forgetful? Like Sadaf mentioned with Shojib misplacing his wallet. Is that dementia? Not just forgetful. We've already talked about there's so many aspects of dementia, not just the memory. And even with the memory, it's memory loss that's affecting your daily life?
I just had something to add on the back of that, which I was actually reminded of today at work about how much people with dementia can actually mask in some of the early stages. So how they can sort of fill in the gaps with something very convincing, tell you a story that does actually make sense and in their mind, and if you don't really know what they're battling with otherwise, it can be kind of like they're compensating for it for as long as they can, especially in, I think, certain people or personalities or communities even where independence is really valued. Sometimes when you are developing dementia, there is an ability to almost brush it off or try to come up with mechanisms or strategies which to your support network can kind of mean that until later on they might think they only notice a memory loss, but when they actually go back, there was like 2 years worth of things that were happening that just were a bit odd, but family members were sort of able to mask. No, I think
We'll move on to the next. Okay. If you've got any questions, we will have some time at the end as well. Okay, so this is one of the things that I highlighted at the beginning. So we talked about dementia, we talked about how we can spot it, what kind of things people are thinking about that might not necessarily be true, but why is it important for us to know? The key thing is recognizing it early. So although dementia doesn't have a cure, there's certain benefits from being able to diagnose dementia early. So one of the benefits is it can slow down progression in some cases. And this is because depending on the type of dementia, we can put certain supportive mechanisms in place. There's certain medications for certain types of dementias that we can prescribe. And then even with reducing your risk factors, so looking at your lifestyle and your diet, the earlier we do that, that means we can maybe slow down how advanced that dementia gets. And then secondly, many people with dementia, if you can imagine it, can be lonely to feel like that, and even for people caring with people with dementia to not have that support in place. So if we recognize if somebody has dementia, we can put certain mechanisms, give certain advice out that can help both them and the people looking after them and the family members. And then also thirdly, it can give family members clarity and time. So experiencing this both from a patient perspective and then also the family can be frustrating, can be confusing if you don't know what's happening, but knowing that, okay, my grandma has dementia and this is the cause of the certain things that she's been experiencing, it can make you feel a bit more at peace and a bit better able to help. From that perspective. I'll hand it over to Sada.
So डिमेंशिया को जल्दी देखना और सपोर्ट लेना क्यों फ़ायदेदार है? एक तो ये है कि हमेशा नहीं, पर कोई केस में क्या हो सकता है, हम आपको दवाई दे सकते हैं या आपके लिए हम दूसरी लाइफ़स्टाइल वाली चीज़ें बदल सकते हैं कि हम ट्राई कर सकते हैं कि वो थोड़ा आहिस्ता हो जाए। अभी कोई पूरा इलाज नहीं है। अगर आपको डिमेंशिया होगा तो फिर वो टाइम के साथ बढ़ ही जाएगा, वर्स हो जाएगा, लेकिन हमारे पास ट्रीटमेंट है और चीज़ें हैं जो हम ट्राई कर सकते हैं कि उसको थोड़ा हम आहिस्ता कर लें, कि हम थोड़ा उसको मैनेज कर सकें। एक और रीज़न के जल्दी डिमेंशिया का डायग्नोसिस लेना फ़ायदेदार है कि आपको सहारा जल्दी मिल सकता है और आप फ्यूचर के बारे में बैठ के प्लान कर सकते हो अपने फैमिली के साथ कि शायद उस वक्त में उनकी वो कोई चीज़ों में नहीं सही आपके साथ कर सकते हैं, लेकिन कोई चीज़ों में अभी भी वो आपसे बोल सकते हैं, आपको बता सकते हैं उनकी विशेष, तो फिर अच्छा है अगर आप जल्दी पकड़ो और वो जो आपको इम्पोर्टेंट वाले कॉन्वर्सेशन करने हैं वो आप जल्दी कर सकें। और एक ये है कि खानदान को वक्त मिलता है कि वो अपने फैमिली मेम्बर के साथ ज़्यादा टाइम स्पेंड कर सके और उनके साथ आप बात कर सके कि उनको क्या उनकी क्या विशेस है और उनका क्या दिल है कि हम उनको सपोर्ट बेस्ट कैसे कर सकते हैं. The next slide. No.
It's me. So, as we've mentioned before, there's loads of different types, but by far the most common type is Alzheimer's. But we did also mention vascular dementia, and when we've looked into this, actually, in the group of vascular dementia, South Asian community tend to make up a large amount of the people that have been diagnosed. And those risk factors can include previous strokes, high blood pressure, anything that you can think of that affects your cardiovascular health, so even diabetes. And other risks that we've mentioned as well is age. So over 65, you're more likely, and then obviously every 5 years, your risk doubles. Genetics does play a factor, but it's not an end-all be-all. And certain things that we can do to counteract that is looking at our lifestyle. So our diet and our exercise. I know our food is delicious and really good, but it can be a bit unhealthy at times. So it's making small adjustments to help you throughout your life. I mean, I love Asian food. Arab food can be very unhealthy as well, but certain small things to help us is better than nothing.
तो सबसे कॉमन कॉज क्या है वो है अल्जाइमर्स. लेकिन हम जब अपना रिसर्च कर रहे थे हमने देखा कि साउथ एशियन जो हम लोग हैं बांग्लादेशी, पाकिस्तानी, इंडियन, हमको वैस्कुलर डिमेंशिया भी हो सकता है. तो वैस्कुलर डिमेंशिया ये है कि जो आपका दिमाग है उसको खून चाहिए. वैस्कुलर डिमेंशिया में वो खून अगर कभी कम हो गया या कोई टाइम के लिए वो खून नहीं गया, फिर उनको डिमेंशिया की चीज़ें शुरू हो सकती है. तो इसको क्या इनके रिस्क फैक्टर है. एक तो ये है फालिज. अगर आपको पहले फालिज हो गया, फिर शायद आपने देखा हो अपने ओन खानदान या फ्रेंड्स में, जब उनको फालिज बाद में हो जाता है, फिर उनकी थोड़ी पर्सनालिटी, शख्सियत बदल जाती है, वो रोना करते हैं, उनकी शायद यादाश्त भी भूल जाती है. तो फालिज एक रिस्क फैक्टर है. एक है अपना ब्लड प्रेशर अगर काफ़ी हाई हो, या आपको डायबिटीज़ हो, या आपको कोई हाई कोलेस्ट्रॉल हो. सारी जो चीज़ें आपको फालिज दे सकते हैं या हार्ट अटैक दे सकते हैं, वो आपको वैस्कुलर डिमेंशिया भी दे सकते हैं. और जैसे हमने पहले कहा, बढ़ती हुई उम्र के साथ डिमेंशिया भी बढ़ता है. कोई जो टाइप है वो अपनी जीनियात में होती है, और कोई अपनी जो हमने दिन बाय दिन चॉइस बनाते हैं वो भी अफेक्ट कर सकते हैं उनको. So I'm talking a little bit about prevention, in terms of just trying to minimize your risk and with things that are in your control. There are certain things that I mentioned, like genetics, which is out of your control. You can't really do much about that, but there are lifestyle measures that we can take to try to form healthy habits. And the first one being to move more. So the NHS recommend at least 150 minutes of activity a week. That could be in any form. It can be in walking, cycling, swimming, attending classes, whatever it is that makes you feel empowered and something that you can really build a healthy habit with. Stick to that. तो अब मैं बोलने लगी हूँ कि हमारे हाथों में क्या है कि हम क्या कर सकते हैं कि हमारी डिमेंशिया ना हो. जीनियात जो है वो तो नहीं, हमारे पास उस पर नहीं कंट्रोल, जेनेटिक्स पे, लेकिन हमारे पास कोई चीज़ों पे कंट्रोल है कि जो हम अपनी ज़िंदगी में कर सकते हैं. एक तो ये है, हिलो, उठो. 100 NHS का रिकमेंडेशन है कि 150 मिनट हफ्ते में आप कोई वर्जिश किया करें. तो वो है, आप जो आपका दिल है करो. आप वॉकिंग करो, या आप कोई स्विमिंग करने जाओ, क्रिकेट, जो भी आपका दिल को खुश रखता है और आप उसको हैबिट कर सकते हैं, वो आप किया करें. और क्या, switching between two languages is so interesting because I was going to carry on in Urdu. going to eat well now. So one thing that you can try to do in your control is eat as healthy as you can. Within our communities, we are known to have lots of fried fatty foods with lots of saturated fats. So it's just about trying to be more mindful. Even within our cuisine, we can make it a bit healthier. We can reduce the portion of rice that we're having, or not biryani. My mum just shouted biryani, so I started laughing. Or we can, no, they're bad foods, pakoras and samosas. That's what you shouldn't be eating. Anyway, instead of having 3 rotis, have 1. Try to, you know what I mean? Increase the amount of protein. Or just modify. You can modify our own food. It doesn't have to be this. Oh, like I have to do this different diet. You can just change what you're eating. Attention in the room, please. Thank you very much. My mum instigated it. Everyone got lost at pakoras and samosas. Yeah, let's keep going. Gulab jamun. What else do we like? Yeah, no, shh. My blood sugar's gone low. No, I'm joking. तो अच्छा खाया करे. ये नहीं मैं कह रही कि हम अपना ओन खाना एंजॉय नहीं कर सकते. मैं कह रही हूँ कि आप जो आपको पसंद है उनको थोड़ा बदल ले. 2 रोटी के बजाय 1 खा लो, या आप अपना प्रोटीन चिकन और ज्यादा सलाद ऐसी की चीजें खाया करो. बड़ी प्लेट बिरयानी के बजाय आधी प्लेट बिरयानी के खा लो, साथ थोड़ा योगर्ट खा लो, साथ थोड़ा सलाद खा लो. Yes. So that's about eating well. Stop smoking and limit alcohol. I think most people in the room don't drink, but if you know anyone that does, you can advise them about limiting their alcohol. तो सिगरेट ना पिए, ना शराब पिए. मुझे नहीं लगता इस कमरे में काफी लोग पिएंगे, लेकिन अगर आप किसी को जानते हो, शायद किसी के पास कोई प्रॉब्लम है, आप उनको जाके भी बता सकते कि अल्कोहल को वो कम करे. Control your blood pressure and diabetes. So we've actually got glucose checks and blood pressure checks here today, but these are all risk factors for what I've mentioned earlier. तो अपना blood pressure और अपनी sugar को control में रखें. यहाँ पे आज वो blood pressure भी check कर रहे हैं और वो अपनी sugar भी check करे. अगर किसी का दिल है वो check करा ले. फिर जल्दी, जितना भी जल्दी करे उतना जल्दी आपको फायदा हो सकता है. Stay connected. So social and mental activity, like coming out here today, not staying in your home, going to social groups, meeting friends, meeting family, that can all be really beneficial. I'll give everyone a second. तो अपने खानदान और दोस्तों के साथ मिला करे. जैसे आप आज बाहर आए हैं, ऐसे आया करे. मस्जिद जाया करे, जिधर आपका दिल किया करे. वॉक पे जाया करे, पर घर में ना बैठा करो. घर में बैठ के डिप्रेशन भी बढ़ता है और डिमेंशिया का रिस्क भी बढ़ता है. जितनी नई चीजें आप बाहर जाके देखोगे उतने आप फ्रेश रहोगे. जी. Treat hearing loss or depression. So hearing loss has actually been found to be like a contributing factor to some people developing dementia. So get regular hearing checks, and in terms of depression, seek help where you need it, and we can try to sort of manage those things as well. तो अपने कानों का ख्याल रखा करें. अगर आपको कोई लग रहा है कि आपको सुन रहा नहीं सही तरह से, आप अपना चेक करा ले. स्पेक्सेवर्स भी करते हैं अगर किसी को चाहिए, पर चेक किया करें, क्योंकि जो लोग को नहीं पता, जो लोग सुन नहीं सकते, जो दुनिया होती है, उनका डिमेंशिया का रिस्क ज़्यादा बढ़ता है. और अगर कोई भी आपको डिप्रेशन है या आपको कोई ज़हनी बीमारी है, उसका भी इलाज देखे. लोगों से बोले, बाहर निकलो, एक्सरसाइज करो. जितना भी आप अपने दिमाग को हेल्थी रख सकते हो वो आप करें. Get NHS health checks. So at age 40 to 74, you should be able to book in with your GP to like get blood, stone, blood pressure, height and weight, all of which we can try to catch things like diabetes and high blood pressure earlier on. And overall, what's good for your heart is good for your brain. So जो आपके लिए दिल के लिए अच्छा है वो आपके दिमाग के लिए भी अच्छा है. जो चीजें हम अपना हार्ट अटैक और दिल को हेल्थी रखने के लिए करते हैं वो ही ब्रेन को करते हैं.
Not finished just yet. We've got a bit more information to give you, and then we'll go on to questions. So, if you feel like you are displaying any of these symptoms, what's the first thing we should do? We should try and see our GP. So, this is a really good way into you getting some testing and trying to figure out if you do actually have dementia or not. And one of the things that they could do is they can refer you to centres that can do memory assessments, thinking assessments, and then if needs be, maybe scan your brain if that's appropriate. And to remember that when you're seeking help, there might not be a cure for dementia, but it's good for us to recognise it earlier so we can try and halt that progression of the dementia. And maybe certain medications can be given or certain measures can be put in place.
तो अगर आपको फिक्र है कि शायद आपको ये चीज़ें शुरू हो रही है या आपके वालिदैन को या आपके नेबर को परदेसी को नहीं हमसाई not परदेसी पड़ोसी, that's it. Getting an Urdu lesson at the same time. हाँ, जिसको भी आपको फिक्र है कि है ये सही नहीं लग रहा या इसमें कोई डिफरेंट हो गया है, तो फिर आप उनको और अपने आप को जीपी के साथ अपॉइंटमेंट बनाओ. जीपी क्या कर सकता है, वो आपके लिए टेस्ट अरेंज कर सकता है मेमोरी क्लिनिक में. वहाँ पे वो सारी चीज़ें आपके साथ बैठ के टेस्ट कर सकते हैं और फिर आपके स्कैन भी हो सकते हैं दिमाग के, देखने के ये क्यों हो रहा है, क्या हो रहा है. इवन अगर ठीक है फिर तसल्ली बंदे को हो जाती है कि ये शायद ठीक है या नहीं. तो फिर इसके लिए कोई इलाज नहीं है, लेकिन दवाई है कि हम दे सकते हैं लोगों को कि थोड़ा आहिस्ता हो जाए या उनके सिम्टम थोड़ा को हम हेल्प कर सकते हैं. और हम दूसरी चीज़ों में भी सपोर्ट दे सकते हैं. घर में रहना कैसे करना है, कैरियर सपोर्ट, जितना ही आपको मदद चाहिए आप वो ले सकते हैं.
And we wanted to highlight some of the support that's available to our community that is free. So the Alzheimer's Society is well known to provide support for people with dementia and also carers. So they have a line that you can ring, and they offer support in various languages. So you can request in Urdu and Arabic, and they have quite a range. I'll just give us a minute. We're nearly done, I promise. So if you did want to give them a call, we've got the line there, and they can give you practical advice as well on certain things you can do in your daily life to help with dementia. And then for Rochdale specifically, there's two services that are available. So if you do go to your GP, they would most likely refer you to Rochdale Memory Assessment and Treatment Services. And this is up in Birch Hill Hospital. And just bearing in mind with them, you would need to go through your GP, and they offer the test that can check if you do have dementia or not. And then finally, we've got Mind, which is the Rochdale and surrounding areas. And they have certain groups in place that people can attend if you do have dementia or if you're caring for somebody with dementia. I know I did have a look. So in Middleton, they have support groups that meet every Monday. I think it's in the afternoon, and they do that fortnightly. And when we've mentioned making sure you're staying social and engaging your brain, these are the kind of things that we can take part in, as well as other activities like maybe doing Sudoku or chess if you can play them. But yeah, if you do want more information on that, you can speak to one of us, or everything's available online as well.
तो हमारे लिए सपोर्ट क्या अवेलेबल है? एक तो अल्जाइमर सोसाइटी है, वो ट्रांसलेट भी कर सकते हैं। अगर आप इस नंबर को फ़ोन करें, वो उर्दू में, पंजाबी, जौन से भी आपकी लैंग्वेज है वो आप बोल सकते हैं। तो फिर बर्चिल हस्पताल में हमारी मेमोरी असेसमेंट ट्रीटमेंट सर्विस है, लेकिन अगर आपको यहाँ जाना है, पहले जीपी को मिलके रेफरल लेना है और फिर आप वहाँ जा सकते हैं। और फिर एक चैरिटी भी है माइंड, वो लोगों को सपोर्ट देते हैं कि जो लोग कैरर है या जो लोग को डिमेंशिया भी है कि वो वहाँ जाके बैठ के सहारा ले सके। तो ये सारी चीज़ें इन प्लेस है।
And I did want to mention, sorry, quickly, with the Rochdale Mind, I don't know if anybody's familiar with Cupsurat's house. I think it's also called St. Vincent's. Yes, yeah. So they have a group that meets there and they do various activities, and that's open for healthcare workers, carers, and people with dementia as well, if anybody wants to attend. So, what are some things that we can do when communicating with people with dementia? So, if you think about the symptoms that we've mentioned, one thing that we can do is try and speak clearly, slowly, try and use short sentences if possible, just so that we know the information is getting in. And listening patiently. I know we can, if you're seeing your own family members starting to become more forgetful and changing slightly, it might make us a bit more impatient and a bit irritated. But just bear in mind that the reason they like this is because of the condition, and that supporting them can actually help in the future. And then just giving the patients the time to respond back. So letting them take their time, gather their words, and eventually the thoughts will start to flow. And then, just like I tend to do quite a lot, use your gestures and eye contact. And then, yeah, just reassure. If they need to come back to a conversation or take some time, then just making sure that that's okay. Let me hand over.
थैंक यू। तो हम जो लोगों के पास डिमेंशिया उनको हम सपोर्ट कैसे कर सकते हैं? पहले तो ये आहिस्ता बोले, अगर अगर आपको लगता है वो आपको समझ नहीं रहे, फिर आहिस्ता बोले, आंखों के साथ उनको देखो, हाथों के साथ इशारे करो, जो भी वो समझ पाए उस वे में आप उनके साथ बोला करो। और ये एक बात है, उनको तसल्ली दे, उनको लड़ाई ना करे। अगर वो आपको कि इस कमरे में शायद मेरी माँ भी है या मेरा बाप भी है, उनको ये ना कहो कि नहीं ये तो 50 साल पहले मर गए थे, ये तो नहीं है, आप ऐसे क्यों कह रहे हो? उनके साथ बैठ के उनको बात याद करा लो, बातें कर लो, कैसे थी आपकी माँ, कैसे थे आपके बाप। उनसे लड़ा ना करे, उनको तसल्ली दे। उनके दिमाग में जो ये आपको वो बोल रहे हैं, वो सोचते हैं कि ये असली बात है, ये रियल है। तो फिर उनको उनको आप जितना भी कर सकते हैं उनको तसल्ली दिया करें, उनसे बातें किया करें। ऐसे ना करें कि वो बिल्कुल ही भूल ही जाए सारी बातें।
Okay, and just more on supporting somebody with dementia, that I know from the talk these will more probably be common sense to us, but trying to see the person as the person rather than their condition. Not everything will be related to the dementia. And then focusing on enabling them. I think that kind of ties with the fourth point, trying to do things that help them maintain their independence to do the activities that they want to do in daily life. And trying to maintain a good routine with familiar objects. So if you know somebody always puts their glasses in a place, making sure it's there will mean that even if they forget out of habit, they'll just reach for that area. And yeah, person-centered care, because everybody's different. Everybody has their own likes and what they want to do, and even between different cultures, we're quite different. So even when we're talking about lifestyle and food, adjusting the diet based on what you eat already. So it's not going to be like a complete change. It's just certain habits and certain things that we can do to help people with dementia. And then a big thing is supporting the carers too. So at later stages of dementia, patients can need more support, and that can be quite a burden on the people looking after them as well. So that's why I think a lot of these groups advise the carers to come along, just so they can kind of debrief and maybe offload with other people as well around them and get some help themselves too.
तो अगर आप किसी को जानते हैं जिसको डिमेंशिया है या आप सोचते हैं शायद उनको ये दिमागी बीमारी शुरू हो रही है, आप क्या कर सकते हैं उनके लिए? आप उनके लिए जैसे उन्होंने ज़िंदगी जी है, ट्राई आप करो कि ऐसे ही आप रखो। उनकी जो रूटीन है, जो उनको पसंद है, जो उनको नहीं पसंद, वो आप हर दिन सोचा करो कि मैं क्या कर सकता हूँ इनकी ज़िंदगी को थोड़ा ईज़ी करने के लिए। अगर वो अपने चश्मे कहीं रखते हैं जिधर बेड के पास, फिर वो कोई और रखने लग जाए, फिर आप हाथों के साथ मूव कर दिया करें कि उनकी थोड़ी सहारा हो जाए। आप लेकिन एक ये बात भी है कि जो लोग कैरर है उनको भी सहारा चाहिए। तो काफ़ी स्पेशली जब डिमेंशिया थोड़ा एंड तक आ जाता है, काफ़ी मुश्किल हो जाता है जो ख़ानदान या जो भी है हस्बैंड वाइफ को केयर करने के लिए। तो फिर बहुत जो हमने पहले मेंशन किया था जिधर माइंड, अल्जाइमर सोसाइटी, आप उन प्लेसेस को कांटेक्ट कर सकते हैं कि आपके मैं कैरर हूँ और मुझे भी मदद चाहिए, तो शायद वो आपके लिए अरेंज कर सकते हैं कुछ।
And then finally, just one back. We've got a video that summarizes what we talked about. That if it decides to play, we'll just put it on for you. Yeah, I think it's working.
So what we'll do is we'll show this short video and then questions and answers. I've just been told that by Sahel that there's some food that might be going cold. So what I would encourage everyone to do is grab some food and then come back for questions and answers, and we'll just sort of be around while people are eating. Does that make sense? Yeah, grand. A little bit's fine. We're having some tech issues. We're having some technical issues loading the video. So why don't we start off with some questions now? I guess before we move to the questions, I would just like to say a thank you to Sadaf and Rukia for that amazing presentation, really impressively put together and delivered. So yeah, thank you so much. Got some mega fans in the audience. Does anyone have a question? Does anyone want to kick us off with our questions? Everyone just wants food. No questions about dementia.
If nobody has a question, I don't have a question. I just want to highlight some issues which you can help to the community. It's like it's a really a wonderful presentation. There is no doubt, and very well presented. The thing which I concern is a pathway. When person finds that somebody in the family is forgetting things, so he goes to the GP, and most of the time seen GP says, oh, don't worry, old age people forget things, rather than sending that person to the memory clinic. When person goes to the memory clinic, then the assessment tools, we have to make sure, are they really culturally appropriate for South Asian people? Because they are using Australian model at the moment. Then when he comes back with diagnosis, then after that, post dementia, no support. There isn't any support available. So people, they need a kind of community-based awareness in third sector. They need to know the difference between MCI, dementia, and delirium. If you ask, I'm not expert, I'm just giving you my, so they need this kind of information. Plus, majority of the people, they have to understand by awareness, because they think it's a non-biological thing. So there is no cure, so who cares? That's okay. But it's not okay. They have to do something, and CST, which is cognitive stimulating therapy, is not available in Rochdale anywhere. So if that is available, some trained therapist, and if they deliver, it can help in cognition. So there are so many other factors. I don't want to take too much of your time, but if you can do anything in Urdu, you want? या मैं इनको ये कह रहा था कि बहुत अच्छी प्रेजेंटेशन थी और बहुत ज़्यादा मालूमात मिली, लेकिन हमारी कम्युनिटी को ये बात भी जानना ज़रूरी है कि जब उनके घर में किसी को याददाश्त का मसला होता है और वो जीपी के पास जाते हैं, तो अक्सर जीपी ये भी कह देता है कि घबराए मत, बड़ी उम्र में तो ये होता है, आदमी भूल जाता है। हालांकि उसे टेस्ट कराने भेजना चाहिए और मेमोरी क्लिनिक जाना चाहिए। फिर मेमोरी क्लिनिक में जो वो असेसमेंट करते हैं, वो जो उनका सिस्टम है वो हमारे कल्चर के मुताबिक है या नहीं है, क्योंकि उससे भी गलतियां हो सकती हैं। इसके बाद जब घर पे आ जाता है आदमी, तो उसके बाद कोई सपोर्ट नहीं है। अडल्ट सोशल केयर कहाँ है, उसका नंबर क्या है, कैसे कांटेक्ट करें, जो केयरर है वो केयरर अलाउंस कैसे अप्लाई करे, उसको कैसे अलाउंस मिलेगा उस आदमी के लिए, और क्या क्या सहूलतें हैं। फिर डिमेंशिया के साथ साथ दूसरी चीजें भी हैं जिसको MCI कहते हैं, यानी उसको माइल्ड कॉग्निटिव इम्पेयरमेंट कहते हैं। एक डिलेरियम भी बीमारी है जिसमें हमारे लोग अक्सर मिक्सअप हो जाते हैं। तो इसके लिए मैंने उनको बता रहा था कि ऐसे प्रोग्राम होने चाहिए, जैसे कम्युनिटी सेंटर है डीपलिश, तो यहाँ पर कुछ ऐसा सिस्टम होना चाहिए गवर्नमेंट की फंडिंग से कि लोग यहाँ आए। मेरा इनको ये कहना है कि हम ये नहीं कोशिश करें कि लोग जाएं, बल्कि हम उनके पास आएं। What I'm saying that we are expecting people to go to the services, and my motto is services should go to the people. Thank you so much.
I mean, incredibly insightful point, really well described, like very clearly talked about. And like these issues are national issues. There's national issues with how people get a diagnosis of dementia. We know that it's underfunded. We know that not just underfunded everywhere, but there are inequalities in how it's funded. So somewhere like Rochdale might not get as much money as somewhere like in London. And I guess there's some of this that we can do things about, and some of it we can't do things about, sat in this room. And I think the point of us coming today and talking was to start the conversation about dementia, because we know that a lot of the time it isn't spoken about. So sort of raising awareness and talking in the community is one way that we can address this. But I totally agree, it's not going to be able to like sort out all of the issues, is it, nationally? But yeah.
I think you covered that really well. I think it's not really just dementia. It's pretty much all kind of health conditions at the minute that aren't meeting their targets or like the most optimum way of doing things. And I guess what we try to do by opening up these talks is getting people thinking and supporting each other in a way that maybe the government can't. So like I mentioned earlier, maybe just looking out for somebody that you think might have dementia and helping them with what you've learned today. And then along the way, trying to sort of navigate that. I can understand why that would be difficult, and with the cuts and things going on in the public sector, I'm not quite sure what the answer to that is, apart from not becoming individualized and kind of trying to keep everyone together like we have done in this room. And somebody, you never know the room that you'll be sat in, there might be somebody who does have expertise on that, or somebody who knows somebody, and that's why it's so important to stay connected, I think.
Yeah, I do agree with you. I don't want to talk about it for too long, because I think I agree with your point that it should be the services reaching out, but this is a problem, like we said, up and down the country, and maybe an aspect that could be contributing is the strain on the NHS as well. But for us, it's highlighting for people who don't maybe have a medical background what dementia even is to begin with, that maybe if we can spot it, we can advocate for our family members. So maybe the services won't come to us, but we can reach out and say, well, we do feel like this person might have dementia, please can they get tested? I'm aware that you can do this and that, because now we know what the services are that are available. We can maybe not request it, but try and advise, push for it for our family members.
Do we have any other questions, or is everyone just very hungry? Any other questions? Yes.
If somebody diagnosed with the symptoms of dementia, how can you help them? Like which exercise are good for them, or or which things are good if they can help, or if the medicine is there, what type of medicine they need to use for the dementia?
What do you prescribe?
Yeah, what will be prescribed? Yeah, so there are medications available at the moment that have got evidence to slow, it doesn't cure dementia, but it slows the progression of dementia. And so certain people with certain subtypes of dementia might be eligible for that. So unfortunately, not everybody who has dementia would benefit from these medications. So, and there's a whole different range of them, and it depends, what type of dementia, and if you've got any heart problems, for example, that would tell me what I would want to prescribe. In terms of how you support that person with dementia, I think some of the points that we had today were, and I think the key that I would take away is got to be individual, like for that individual. So some people will have a dementia that makes them very agitated and very anxious, and in that person you might focus on things that make them feel calmer, or things that reorientate them into like their lived environment. Some people have dementia that might make them predominantly memory forgetful, and in that scenario, you might go for an approach that key about not arguing with them. I sometimes find that family members will be like, "No, you're not. You're in hospital," and try and correct that person and try and it never works, and it just makes people scared and fearful and sad, upset. So I think it has to be tailored for that individual. In terms of what exercise to do, I think there were some good points about memory exercises, which may or may not be appropriate depending on what stage of dementia. But also just getting people, we know that getting people outside is really good for your mental health and your well-being. So any sort of exercise. And I think again the point that Sadaf and Rukia made is what that person enjoys. So trying to keep enjoyment and quality of life. It's a bit of a woolly answer, but that's the best that I've got. Yeah. Any other questions at all? No. Please stop. Heckler in the front row. Any other questions? So just to close then, is the video's not working?
What we'll do after the food,
Yeah, okay. Fabulous. Yes, so we've oh, you've got online feedback. Oh, fantastic. So I've printed out some well, I say Sadaf has printed out some feedback forms that I made today, but I think Suhail's gone far too, advanced for me. I'm way behind. Has got feedback on iPads, so some of the volunteers will be coming round to get feedback, and it's really helpful if you can tell us what you liked about today's session, what you didn't like, and what you'd like us to do differently next time. Whilst you're having food and talking to people around the room, come and find me if there's something that you want us to come and talk to you about. We've got, I've got lots of friends who are very willing and excited to come to Deeplish to talk to you about health conditions. So please just, lots of different doctor friends basically. So anything you want to hear about, stroke, I've done a talk about stroke before, I could do that again, or heart disease, respiratory disease. Our next seminar will be respiratory disease in January, but any ideas you have about next seminars, and don't forget to get your blood pressure and your blood sugar checked at the back as well. And cholesterol too. Oh, it's cholesterol instead. Okay, fabulous, excellent, great. Thanks so much, and I'd like to thank again our speakers who are excellent.